Making the decision to undergo any type of plastic surgery is a big one, and making an educated decision is very important.
Today, Dr. Bradley Bengtson from the Bengtson Center for Plastic Surgery is here to talk specifically about new and exciting things for breast implants. Welcome.
Hi, ladies. How's it going?
Great.
Good.
Well, you seem to be a pioneer. I know that you are a very experienced doctor, but you've done a lot in this field.
We do a lot of breast surgery. I've been kind of involved over the last 20 years and a lot of real exciting aspects in plastic surgery, and particularly when it comes to breast implant research and technology. So one of the implants we're going to show in just a few minutes I have one of the largest patient experiences in the United States with an FDA trial implant we're hoping will get approved sometime over the next year. And it provides a great option for patients along with the other implants that are out on the market currently.
So how is it different?
So, I used to think of breast augmentation kind of as an event, but really it's an entire process, and it's very complex to get a patient through all the different types of implants that are available, all the information that's involved, patient selection, implant selection, and then performing the surgery is just like one piece of that whole aspect. And so saline implants have been around for a long time, and they're actually very rarely used in my practice now. The FDA approved these gel devices in November 2006, so they became much more prominent of a device.
Only 6 years ago.
Just 6 years ago. They reapproved them back on the market, so they were off the market for about 15 years for aesthetic reasons. And then during that time period, the multiple different companies, this is one by Allergan that I work with, created these shape devices, which are really what we call the 5th generation of gel implants. And they kind of have gotten their name Gummy Bear, and the reason for that is the gel is very, very thick. And so actually I cut one of these implants just off the set so you can actually see how thick the gel is. So even if the shell does kind of fail, then there is the potential of the gel mainly staying kind of within the implant itself. And so as an example, I took one of my kids' gummy bear vitamins today, and so this is kind of the aspect or the thought behind it, that even if the shell fails, the gel stays on the inside.
And I know that's a concern because years and years ago there was obviously a big lawsuit, and we're talking silicone, and that was it. Basically, that if they were broke or punctured, and they would go into the system and they would leak and not stay contained like that.
Yeah, there's a lot of myths and misconceptions about that, but essentially the devices are much safer because the gel is so much more thick and cohesive now.
Okay, so let's talk about the appearance, because having this, we've had the opportunity to feel them. They actually feel like normal tissue.
Very natural, and first of all the surgery I do is very restored, and it doesn't really matter to me if it's a breast reconstruction or revision after prior breast surgery, or a patient who has like an A cup on one side and a C cup on the other side, or a patient who's lost volume after breastfeeding. It's all about restoration of a natural, normal, proportional volume. So these new shape devices, they have about 250 different sizes, shapes, dimensions, those sorts of things. So we can really kind of fit and just really very precisely match a patient's breast to their body.
Yeah, so part of the process is basically meeting with you and deciding what's best for a patient.
Yeah.
And you really have some different ways to help people get to that point.
Right. So we have, some really, really cool 3D imaging technology that we've actually promoted on the show multiple times. And so kind of gone are the days of before and after photographs. The patient's breasts are really the most critical aspect of what their final outcome is going to be. So looking at someone else's photos is not very helpful. And kind of putting an implant inside of a bra or bra stuffing is also not very helpful. So we're able to actually show a patient actually without the bikini, obviously, but just the range of results that can actually be achieved, and so they can see their potential outcome before actually having
Which is really
surgery.
important, because a C cup to one person may be a different definition to a C cup to another person.
Absolutely.
You want to make sure you're on the same page.
Exactly. Exactly.
with your patient.
Yeah, it's the critical piece.
Yeah, so people go in and they say, okay, how is this going to look? It seems like there are not a lot of opportunities when you opt for a lot of surgeries in general to get this kind of advantage, to
Right.
see what it's going to be like even
Absolutely.
before you have it done.
Right. So once you get past the cost and the safety aspects of silicone, it all comes down to outcome, right? I mean, I don't want to be too big, but I want to, have enough of a change to make it worth it, right?
Right.
Or if I'm matching another side or something like that.
Or if you have had surgery, maybe you're a cancer survivor, and you just really want to restore yourself.
Right.
That's a huge part of what you do at your practice as well.
Yeah, it's all about restoration of natural, proportionate, breast to the body. So.
You have an opportunity this Thursday for people that have been thinking about this or may have questions for you to actually come and check it out and learn a little bit more.
We do. So we have a lot of opportunities for patients to come in, either come in just for simulation, they can come in for kind of fast-track evaluations, even if I'm not there, or for full consults. And then we also offer seminars throughout the year. One is this Thursday, focusing on breast, and we're going to have the opportunity to see all this new technology, and actually we can do some mini consults, and so patients can actually experience the technology.
Yeah, and you're throwing in
themselves.
some things too, Latisse and skincare treatment just for attending?
Yeah, so we always have complimentary things. I think we also have some discounted pricing for surgery for the summer for attendees. So.
And people also have the opportunity to walk through your just amazing state-of-the-art facility, including some new imaging technology that you're using, and specifically when we talk about making sure that you can determine how safe these implants are.
So we do. We're kind of doing some groundbreaking research when it comes to breast implants and implant technology. One of the things we're really excited about is we just published the first kind of landmark article of high-resolution ultrasound and looking at ultrasound versus MRI, which currently is the gold standard to look at breast implants. So we have this technology now, and I think this is really going to be neat because we're going to be able to just follow implants over time. It's almost like X-ray vision. I mean, just kind of looking and following implants over time inside the body. So it's a great thing for patients, plastic surgeons, and companies as well. So.
Well, it's interesting. You've been doing what you've been doing for a long time. I know pretty much the expert in this area. And so it just shows that you're involved with this trial of 450 patients.
We have the largest single center study for augmentation with the 410, and we're, again, I just feel very fortunate and blessed to be in a position where a lot of the real exciting things in plastic surgery really all kind of coming to a head. And I would just ask by Allergan to kind of head up their educational aspects for plastic surgeons when this implant is eventually launched. So just a real exciting time in plastic surgery right now.
Yeah, which is great peace of mind for somebody who is at home considering one of these procedures. You know that Dr. Bengtson has been selected to actually help lead the training of other doctors across the country, and so that's a huge mark of confidence for you.
Yeah.
It's great stuff.
So where are you located? Yep.
So we're in the Women's Health Center, just off College in Michigan, and it's the big, beautiful building right on the main floor. And we're excited to have you guys come down. Hopefully, we'll be able to come down and visit us on Thursday.
You have a beautiful office.
Yeah.
Thank you so much for coming in and sharing this information with everybody.
It's been great. Thanks.
We'll be right back.
This is 8 West.